All right. Hi, this is Dr. Liz with Dr. Liz Soul Care or Soul Care Enterprises. I'm sorry. I am branching and rebranding. So I am a licensed professional counselor, LPC. But I've been providing counseling for many years. But before I get into that, I just want to say I am the CEO of Soul Care Enterprises, as you can see behind my head. So I am jumping into the ring. I've been asked to speak on the differences between the differences between being a licensed professional, a life coach. How do you know, not misrepresenting yourself? And if anybody has ever worked with me, I've worked with a lot of interns over the years, and I've gotten on their nerves because I'm like, well, you can't do this, but you can't do that, and my license is on the line. And so it can be frustrating for people, but licenses do matter. All right, so I'm going to do a quick little thing. I do have some of my little degrees here. When you get licensed, you get a certificate saying that you're licensed. Wait, the background's on, so it's hard. Ah, oh well. Okay, there it is. Says that you're licensed. You get a certificate. You also get one that you put on the wall, okay, in your private practice. And then when you get your degrees, I don't know where my undergrad degree is somewhere, but okay, Oral Roberts University. Okay, so when I got my master's, you got that because that's my master's. It was in Christian counseling in the School of Theology, Seminary in Theology, but it's now called professional counseling, like most of the counseling programs are across the country. All right, and that's how you get your LPC, or one of the ways. It's an LPC, licensed professional counselor. But I'll tell you how you get that. This is my doctorate when I returned back to USM, and I got my doctorate. No, I'm not a psychologist. The doctorate is in education. And so I got a PhD. Yes, I did a dissertation. I did all my chapters, my 5 chapters, and all of my research. And it took me a second. 2 babies into it, but I got it. Okay. I am also a board certified telemental health provider. Board certified telemental health provider. That's in our state here in Mississippi. You have to have that to provide telehealth. And I do that right now. I've been doing it for many years, especially right around COVID. Okay, I got that. All right. And then I got a bachelor's degree. Okay, whatever. But apparently it matters because some people love to falsify and misrepresent themselves. Most of us who get degrees are not trying to brag. We're not doing it. We're doing it out of our own personal convictions, our own personal drives, goals. That's why we're doing it. It's not to, I mean, some people are doing it for whatever, but if anybody's ever gotten a degree, a doctorate degree, most people are very humbled by that experience and very proud to have it. And there's no need of misrepresenting it because in mental health, for instance, they only people who are, I mean, if you get a PhD in psychology, you have to do certain things to get your license to become a psychologist. If you don't do those things to become a psychologist and register with that board, then you can get your degree. I mean, you may have a PhD like me, but you're going to be a licensed master's level counselor, right? So my PhD is in education. Okay, but my master's is in counseling, right? I have a license. I did marriage and family therapy also track. So I could have gotten the LMFT, which is licensed marriage and family therapy, as well as the the LPC, licensed professional counselor. So you can do various things. You may have someone who gets a master's and they don't do the work that it takes to get their license. To get a license, you have to take a test. It's very hard. Some people don't pass the first time, the second time they got to take it over. It takes a minute. You got to do at least 3,000 hours. They have different programs that it may be a little less based on some other things that you can do. But technically, you have to see, once you've graduated with your master's, you have to see 3,000 hours, see clients for 3,000 hours. So you have to accumulate 3,000 hours within 2 years. And you're also doing receiving supervision from a licensed supervisor those 2 years. Then you have to take a test. Some people have to take a test right after they graduate, before they start. it's not an internship, but their supervised work, and then they have to take a test again after they've accumulated their hours, their supervision hours, and they are ready to take the test. Then they have to take a test again to determine if they're going to be licensed. So it is very rigorous. It is nothing that you just jump into. And if you're licensed, you're licensed. You are covered and monitored and supervised by not only the licensing board, but also you're governed by those ethics and rules and laws that are under that. We have to do CEUs and make sure that we continue to stay up on the training to remind ourselves, and we have to do those CEUs and report those CEUs every 2 years at least, to make sure that we're compliant with what we're saying that we're doing. We have to make sure and report and verify that we're doing what we're supposed to be doing. Okay. So that's very important. That's a licensed professional. That, yes, there are people that don't have the licenses. They may have their master's degrees in their social work, counseling, psychology, marriage and family therapy, something like that. So they may have their degrees in that, but they have to do those 2 years. After you graduate, you have to do 2 years. And of what I just said, before you even graduate in the master's program for any of those mental health fields, you're going to have to do internships. So you have practicum and internship. I've had about 30, it's over 30. And when I did the work, over the 20 years that I've worked, since 2008 is when I was in private practice. Since that time till now, I have supervised over 30 individuals in their master's or undergrad programs. That's a lot of supervision, helping people come up in the mental health field. Okay. And again, some of them choose not to pursue the license. Some of them got the master's and, decided they're going to do something else. That is fine. Some people don't get a degree at all. Then what else can they do? I also do this as well. You can do life coaching because you have years of experience or you have a specific experience in a particular area. You can do life coaching. You just have to make sure you tell people, I'm a life coach. I may call myself Dr. Liz with my life coaching, but I'm not misrepresenting myself and saying I'm a psychologist, because I'm not. I have a PhD in education. So I'm going to help you with some psychoeducation things, right? You bring you with you everywhere you go. So yes, I may be a mental health professional, but in life coaching, or if I'm working with someone, even in business, I may not, specialize in one area or another, but you bring your expertise, you bring your knowledge base into your coaching. And as long as you stay in your lane of coaching and you're not saying you're a doctor, you're going to, provide some type of medical procedure, or you're not doing mental health and you're not doing that type of work, then you have your delineal lanes, right? Delineated lanes, and you have to do your due diligence to maintain those boundaries and to communicate who and what you are. That's it. And then help people, because that's why we're here, right? That's why I'm here. I'm called to do what God has called me to do, which is help people, to heal them in their heart, help them to process, to build them up where they've been broken down, because I can relate, and to help them rise restored in their soul, in their whole body, spirit, mind, body, soul, right? In their behaviors, how they interact with people, in their communication, in their love, all of those things. And all of us as providers, some people are general practitioners, like a family doctor. Some of us specialize in certain areas. I've worked with mental health. I've worked with residential treatment facilities. I've worked with group homes. I've worked with prisons. I have worked in doing substance abuse assessments. I have worked with court appointed. I have worked in intensive outpatient programs. I have worked as a military family life counselor with the subcontractors and contractors with the DOD. for many years. So I worked with military of all branches of the military and their families. So I did that for many years. I have worked and I've taught in higher ed and taught general psychology. I have worked in acute hospitalization for people who've been hospitalized. I've worked in a community mental health program. I have worked as a support person still in mental health when I was working on completing my degree in counseling while I was working, was a family support person with a school. And I also worked providing home-based counseling when I was in Tulsa, Oklahoma, working on my master's, or just graduated my master's rather. So have done the work, have the life experience. So it's important to not misrepresent yourself. It's important to be trained. It's important to do your due diligence and not hurt people. And if you're called to help, that's all gravy and it's groovy. In the state of Mississippi, everybody's different. Every state has their own licensing boards. For instance, I couldn't practice right now in some other state as a mental health provider. I don't have a license all over the place. So where my license is, that's where I provide mental health counseling, which is Mississippi right now. Now, if I wanted to, I can branch out and get licenses in other states and provide that service. Life coaching, for the most part, that is generalized, and you can provide that all over. And it's not as rigorous. It's not as you can get a life coaching certificates or trainings and things of that nature, but it's not necessarily required. So people who want to do life coaching, great, they can do their due diligence and seek out a program. I even have my own to help train new and upcoming coaches. So if you wanted to, you can reach out to me. You know, so it is great. It is very important, rather, to come to someone so that you can get the proper training, so that you don't do any harm, that you help people in your expertise, in your area, in your lane. That's important because God has called us all to do something, and He brings us out to help go bring other people out. Right? Okay. So that is very important. I will do another post later because my technology wasn't working to do a differentiation, but I will speak one more thing, and that is I have been in ministry for over 30, well, since I graduated from, when was that? Well, before I even went to get work on my master's. I mean, I have a master's in theology. I'm licensed. I am ordained minister. And I worked with my husband for over 34 years. He's been in ministry. And so, yes, in Mississippi and most places in the U.S. and around the world, I would assume, pastors can provide pastoral counseling. But there's also a division where people can go get a degree in pastoral counseling. So it's a little different, but overall, pastors can provide counseling, pastoral counseling. They're not mental health professionals, but they do provide pastoral counseling. They can do their own version of life coaching, right? That is something you can do because you're specializing in an area of your expertise and experience. And as long as you're not misrepresenting that, then go out there and help heal God's peeps. So there is a way for us to be able to help people, but to your own self be true. Look, God has called us all to be great things. One thing that my mom taught me is be proud of who you are, be proud of what you can do. I don't have to fake the funk with anybody. I don't have to make myself be anything but what God has already made me to be and what I'm allowed to do based on the parameters I have. If I want to be called something else, then I'm going to have to go get that degree. If I want to be blah, blah, blah. There are many years that I said, dang, I should have went to medical school, but I ain't a doctor. I am not a medical doctor. There's been many years when I said I should have went and stayed in Tulsa because I was going to get it. I was going to work on my PhD in psychology and become a psychologist. Life happened. Life was lifing. And I didn't do that. There's still something I could do. I might. I don't know. Don't make me lie. But I'm not going to sit here and say, okay, I have a PhD. Yes, I'm a psychologist. I am not. My PhD is in education. So I provide psychoeducation as part of my life coaching experience. I also use a lot of it as I am branching out in my soul care enterprises with my trainings. That's going to be training life coaches and helping them get their certifications, as well as some other various different adult education dynamics where people need help in learning about AI, and that's my AI consulting as well, and then helping businesses develop, and small businesses and African American based and minority based businesses coming up with AI innovations, and so they can be on a level playing field. So that's what I do. But I just wanted to speak to what is going on out here in internet land, because it is an important thing. It's not frivolous. It's not someone coming after someone, but it is very important that we stay in our lane. But it's not just staying in our lane, because God calls us. Some people can multitask. Some people can't. Some people say, I can only see this type of people, this group of people, and that's it. That's great. But then don't disparage on me. I already told you all of the 20,000 things I've done. Don't, come at me because I can do more. But don't come at me if I don't want to do this particular thing either, right? That's why we have is more than enough providers. Oh, I want to speak to, okay, if you are a licensed provider, if you're providing mental health, you can either choose to use insurance and not insurance. Doesn't matter. You don't have to use insurance. You can use private pay. Insurance is just a lot of people, African Americans, minorities, people who have been poor, have been able to come up and actually finally receive services because of the insurance. In my practice, 90%, 95% of the people that see me of all ages and races and genders see me and use their insurance. That's why they do it. And I haven't turned to 100% cash pay. Lord knows the insurances do not pay like they're supposed to. That's a whole nother topic of discussion that I'll do another day. I'll do another day. Let me have this. Talked about insurance and went crazy. I'll talk about the insurance another day and how they don't pay. But still, as providers, we are definitely not getting rich off of the insurance, but we're taking it so that we can see people, because that's how they're able to avail themselves to those services. Okay. And so, yes, if you come to counseling, you're going to get a diagnosis. But I always tell people, you don't have to worry. The diagnosis is like no difference than, okay, you go and you bump your toe and you go to the ER or go to the clinic, and they're going to put down a diagnosis. What does that mean? What's wrong with you? What are we fixing today? So if I'm fixing anxiety or your relationship, or depression, we just working on some adjustments. Don't nobody care. They really don't care. And people that are going to be gossiping about you don't know that you're getting counseling. Avail yourselves to that counseling. Don't listen to people. Don't let people put fear in you. Like, oh, if you put the insurance, somebody's going to know. Nobody knows. That's why it's HIPAA. That's why there are laws that we can't share your information. And if there's somebody who gossips and want to tell business so much, they don't need to be a counselor, because it is not that serious. I see too many people to want to tell your stuff. So most sound, competent practitioners are not telling your business. They're not supposed to. That's against the law. So use your insurance and avail yourselves to the help that we are here to provide, because God has put that in our hands. We all have different gifts, and there's a lot of us who are called, and we're definitely called to our community, people of color. And so I want you to know that we're here for you guys. You can always look me up at Dr. Liz at Soul Care Enterprises .com, and we're here for you, or drlizsoulcare.com. Okay, so I thank you for this time. Go out there, be healed, rebuild, and rise restored. God bless.